Every minute, somewhere in the world, a man is diagnosed with prostate cancer. While it might be easy to dismiss or overlook, knowing the warning signs could save a life, perhaps even yours. In today's video, we're diving deep into the alarming signs of prostate cancer that every man should be aware of. One of the first and most noticeable signs of prostate cancer is you can start with changing in urinary patterns. This can include a frequent need to urinate, especially at night, or during the day where you may urinate and then within 20 to 30 minutes you feel like you need to go again. You can start to have a weak urine stream or difficulty with starting or stopping your urine flow. You can also get a sudden urge to urinate and some incontinence or dribbling after you pee. The reason this starts to happen is that as the tumor grows, it puts pressure on the urethra where the urine leaves, causing a slow obstruction. Now, I don't want you to start to freak out if you're having any of these symptoms. If you have them, it doesn't mean that you have cancer. These are just signs that you have a prostate that is becoming enlarged. The most common reason this happens is because you're getting older and your prostate is getting bigger. The hard part is that it's possible that the reason your prostate is bigger is from a tumor growing inside of it. That's why you don't want to ignore it and should talk to your doctor about it. Another sign you need to look into is if you see blood in your urine or semen. In younger patients under the age of 40, this is rarely a sign of cancer, but for those over 40, it is something you need to look into. It's still rare that the cause will be cancer, but you don't want to ignore it. There are other concerning causes, including different kinds of cancers in the urinary tract, that it could mean, so get to your doctor right away. This next sign may make you rethink trying to buy that Viagra from the online doctor. One of the later signs of prostate cancer can be erectile dysfunction. You see, a tumor growing in the prostate region can disrupt the intricate network of nerves involved in achieving an erection. By far, the most reasons that a man gets erectile dysfunction have nothing to do with cancer, but it does highlight the need to get it looked at by your physician if you start to have these symptoms. The next sign is one that may come as a surprise to you. Persistent pain in the hips, lower back, or even the chest can be a sign that prostate cancer has spread to the bones. In fact, the bones are the most common place for prostate cancer to spread to. It's not unheard of to diagnose an advanced prostate cancer because a man comes in complaining of chronic back pain and you see a tumor on an x-ray. Most often these pains come from everyday strains of aging, but it's crucial to listen to your body and seek professional advice if you have a pain that is just not going away. Next, you need to look out for weakness or numbness in your legs and feet. This is related to the sign we just talked about. If you get a tumor that spreads to the spine, it can start pressing on the spinal cord, causing pain, numbness, or weakness. This may progress even to lead to difficulty controlling your bladder. Just like the other symptoms, this doesn't mean you have cancer, as there are a lot of reasons this can happen. But if you're having these symptoms, no matter what the reason is, you need to get seen because it can be dangerous. So don't ignore any changes like this and get into your doctor right away. Now, the last sign that we're going to talk about is sudden or unexplained weight loss. Many of us would cheer if we saw that we were losing weight, but if you're losing it rapidly or aren't doing anything to lose weight, then you need to get looked at. Cancer is one of the most concerning reasons that can happen, and prostate cancer may just be the cause. Now, I don't want y'all freaking out if you have any of these symptoms, because if you do, remember, it doesn't mean that you have cancer. These are what we call non-specific symptoms, or symptoms that can be caused by a lot of different things. However, they're important to know because they're also easy to dismiss and think that it's nothing. Most of the reasons that you may have these symptoms have nothing to do with cancer, but because there is a chance, it's important that you get them looked at. Prostate cancer is no joke, so get into your doctor and ask them about your risks and whether screening is something that you should do. Cancer in general is something that we all worry about, so we've tried to make it a little easier for you to know what you need to be looking out for, not only in prostate cancer, but a lot of other different cancers. So keep watching this video right here so that you can know some of the most common signs of cancer, so you can hopefully catch it early. And thanks for watching, and we'll see you in the next video.